Ketamine as a treatment for depression and other mental health issues is becoming more popular. Now, currently, nurse anesthetists and doctors are using it, even though it is not regulated by the FDA and it's still considered experimental. Well, we found several clinics here in Tulsa offering ketamine treatments, so we sent 2 News senior reporter Sharon Phillips to take a deeper look at this drug, sometimes referred to as a spa for the brain.
Ketamine is a medication used in general anesthesia. It causes an altered state of sensory perception without the loss of consciousness. Although ketamine is still considered off-label, some have found it to be an effective treatment for depression. 18-year-old Jackson Mitchell says he has struggled with anxiety and depression most of his life.
Yeah, about since I was 7 or 8. I tried all sorts of medicines. I did therapy. Medicines were like Prozac, Zoloft, Effexor.
When the medicines didn't work, he began researching depression and anxiety treatments online. Mitchell says he finally found relief at Oklahoma Interventional Infusion Center, where nurse anesthetist LaVonna Sanders started giving him a series of ketamine infusions.
Going into it, I was pretty scared, but once I got on it, all that went away.
For those that might consider ketamine treatments as a way to get high, Sanders says that's not the case.
It's not the same as the ketamine that's on the street. The dose is much lower. It's a slow, low infusion. They might feel a little dissociation with it and maybe some dreaming, and then it's really a calming and pleasant experience, but it's not a high.
For me personally, the feeling of getting high is kind of uncomfortable a lot of the time, and this has really helped with my depression. I probably wouldn't have been able to do this interview before.
According to Sanders, ketamine is safe when administered in a controlled setting in a low dose and monitored by a quality provider.
It's regulated because I'm an advanced practice nurse, it's regulated by the Board of Nursing.
The National Institutes of Health, along with Yale, Harvard, and Johns Hopkins, have researched ketamine's effect on depression. Currently, ketamine infusions are still considered off-label by the FDA. Aaron Pierce, a psychiatrist for the OSU Center for Health Sciences, says there's some evidence it works.
There's a fair amount of data that suggests that it does work well for depression, for treatment-resistant depression. It helps probably about 60% of people who would have at least a response to the medication.
But he says that ketamine tends to wear off after 2 or 3 weeks, and the symptoms can return.
I can see the hesitancy in wanting to refer to these clinics when, it's not a well-established FDA-approved, treatment for depression just yet, and the fact it does tend to be pretty expensive.
Both Sanders and Pierce say it's critical as psychiatrists evaluate anyone interested in ketamine treatments. Across town at Seva Medcare, Dr. J.N. Patel is treating his patients with ketamine. He wholly agrees that patients need to be under the care of a licensed mental health care specialist prior to treatment.
We would make sure they're wholly invested in psychotherapy and a psychologist as well as a psychiatrist, and they've had a full workup, and they have the ability to open up and talk to someone, and they're having ongoing coaching. Once that is extinguished, we can then incorporate ketamine while that individual is under the care of another mental health specialist.
Several ketamine studies show a low dose of the drug typically has a 70 to 80% success rate when treating depression. Sanders recommends a patient get at least 6 infusions and says most will see a difference after 2 or 3. For Mitchell, the drug has been life-changing.
It's been really helpful for me, and I think anyone suffering with these issues should take a look at it, maybe consider giving it a chance.
Ketamine infusions are not covered by insurance. Now, they typically cost around $350 per session, and the process lasts about an hour. Sharon Phillips, 2 News, Oklahoma.